850,000 people live with dementia in the UK. This number is predicted to rise to over 2 million by 2051. By 2025, it will be more than the entire population of Birmingham, UK's second largest city. And by 2051, that number will be more than the entire population of Liverpool, Manchester and Birmingham combined. To put that into context, 1 in 688 people under 65 have dementia. 1 in 14 people over 65 have dementia. 1 in 6 people over 80 have dementia. So it's important we know what dementia is before we can do something about it. With the aging process, changes in cognitive ability may be expected. However, dementia is not part of the normal aging process. It is a disease which is different from normal aging. With normal aging, changes to one's cognitive ability can be down to the loss of sensory deprivation, such as sight and hearing, which will certainly affect memory recall, social isolation, bereavement, and comorbidities. With normal aging, we can expect memory loss, slower reactions, more cautious actions, and a decline in sleep. However, it's worth noting that language and vocabulary can actually improve with age. In the UK acute hospitals, 2/3 of patients are elderly, and 50% of those have dementia or dementia-related conditions. Dementia is caused by a disease of the brain. Overwhelmingly, the most common is Alzheimer's disease. This is how a normal brain would appear from a scan, and this is how a dementia-affected brain may appear. The CT or MRI scans will show brain shrinkage, atrophy, although in the early stages of Alzheimer's disease, the scan may not show this though. So why is this an issue? Well, those suffering with dementia feel vulnerable and in need of support, and carers, friends, family, healthcare workers need to do as much as possible to help them retain a feeling of identity and self-worth. Dementia is a disorder of cognition. That's our ability to make sense of the world, and it affects speech, perception, planning, behaviour, language. Some of the first signs include lapses in memory and problems with finding the right words. To understand the type of memory loss, we need to be aware of the two types. Explicit memory, which is about conscious recall, takes effort, and implicit memory, which is automatic memory. Memory that is unconsciously stored, such as getting dressed, combing the hair, talking, walking, cycling a bike. Talking and walking are part of our crystallised memory, and this explains why people with a dementia can't find the words they wish to use, and why some types of dementia are often characterised by frequent falls and sometimes the inability to walk. Another example of a memory problem may be forgetting the way home from the shops or being unable to remember names and places. Other symptoms include mood changes, particularly as part of the brain that control emotion become affected by disease. People with dementia also feel sad, frightened, or angry about what is happening to them. Communication problems develop over time. For example, a decline in the ability to reason, talk, read and write. So if dementia is suspected, the first person to consult is the GP. The GP will assess the person. They will look at the family and the person's medical history. They will normally carry out a physical examination as well. The GP may well refer them to a consultant who will have more specialised knowledge and experience of dementia. There are 9 areas of impairment. The presence of any 3 of these 9 may indicate dementia. The effect of dementia on the brain leads us to observe other distressing behaviours such as phobias, fears, sleep deprivation, depression, anxiety, delusions, hallucinations and behavioural problems. Our behaviour towards the dementia sufferer needs to be respectful. We need to make sure that we don't patronise them. As their language deteriorates, we need to focus also upon our own non-verbal communication cues. These include facial expressions, voice tone and posture. We may find that we need to use very concise sentences, or maybe just 2 or 3 words. Due to changes in their ability to use language, we need to listen carefully, check our understanding, especially when this person speaks, they may well swap one word for another. In the UK, 225,000 people develop dementia every year. That's roughly 1 person every 3 minutes. So in the time that this digital story has taken, another 2 people have been diagnosed with dementia. I hope these few words of advice will help you deliver better quality care to somebody suffering from dementia. with great thanks to Professor George Tadros, Dr. Neil Ferguson and the Alzheimer's Society.